part of the lecture is going to be didactic in explaining about pain management, what is pain, pain tolerance, some of the history that's going about, who's done research, and then what our therapy is, and how I work with patients to integrate that. How did this come about? I did a dissertation years ago, and I emphasized working with patients with a chiropractor. The patient would go to a chiropractor, and they had to present with a chronic headache, neck ache, or back ache. They would see the chiropractor for so many visits, and then he asked if they wanted to partake in the study. And then they would sign up with me for so many visits, where I would hypnotize them, teach them self-hypnosis. We all know self-hypnosis? So we would teach them self-hypnosis, well, I would teach them self-hypnosis, and then integrate the therapy for pain management. But the critical part that was missing in some of the documentation that I researched was the art therapy, really getting into the affect of pain. So they would draw their pain image before I would hypnotize them. Then I do the induction. No, relax after the induction. They'd open up their eyes while still in trance. They'd draw their image again of their pain or discomfort. If they had any at that point, you'd be surprised what you see. And then I'll do the treatment of the pain management. And then after the completion of the hypnosis therapy, they would get up and draw again. So some of the slides at the end of the PowerPoint presentation, you will see some of them didn't want to do the middle one because they didn't want to mess up their trance state. But most of them you will see the 3 drawings. Okay? And what I have along the side here is an example of what is a transformation of pain imagery. Now, when we also talk about pain, it's not just physical pain I work with. I work with emotional pain. And how am I able to do that? So let me introduce myself. So I'm Norma Ann Fagone-Ledgaro, and I have a double doctorate in clinical hypnotherapy. So I have a DCH, which is a clinical doctorate, and I also have a PhD. And this is the presentation of my research of that PhD, which I also created a book. I'm allowed to give a 1-minute plug, and it'll be on the NGH, in the NGH bookstore, and it is called Bridging Alternative Medicine. And if you're interested, we can talk about that later. Thank you so much. Now, what you're going to see in my credentials are in your PowerPoint presentation as well. So as a licensed clinical mental health counselor, and I'm licensed in Rhode Island and Massachusetts, I see the people as patients because I'm also working in the clinical area, okay? Which may be different for some people here. A little brief history now, and I don't want to block this. So we have $34 billion estimated that's spent on alternative medicine, let alone what's spent on allopathic medicine. And that's the traditional. You go to the doctor and they'll write a script. And so people are really looking outwardly to find holistic medicine. And that's why you're here. You want to spread the good word, as David said. We have to use our voice and really spread the wealth of the information that you're going to get here and take along with you so that you can help in a more holistic way. So we don't have to use